TARKA SAMVADA, bringing voices together. A podcast exclusively organized by Team Panchajanya. Panchajanya, the divine conch of Bhagwan Shri Krishna, which was blown during Kurukshetra, indicating the start of Dharma Yuddha that followed. All the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in mind, our organization will work towards establishing the importance and necessity of following and imbibing Bharatiya culture, accepting our roots and making people realize the true essence of Ayurveda, not only as a treatment modality but also as a way of life. All these while walking in the path of Dharma. Hence the motto, Shreyam Paratiyam Arogyam Ayurvediam. Welcome to the second episode of TARKA SAMVADA with Dr Chetan Upadhyaya sir. Chetan sir is a renowned Ayurvedic surgeon with an enormous experience in Ayurveda and surgery, making him a unique surgeon and effective Ayurvedic practitioner. He completed his UG studies in the reputed STM College of Ayurveda, Udupi and postgraduate studies in RGHS, Bangalore. Got trained in general and plastic surgery in the Punya Institute of Plastic and Reconstructive Surgery in Bangalore for 3 years under renowned surgeon Dr. Pradeep Kumar N. He has performed more than 2,500 surgeries in his experience. He is the founder of India's first integrated medical company called Praana Vaidya, which has 6 branches all over Bangalore and is expanding. His contribution in the vision of making integrated medicine the new face of healthcare is remarkable and well appreciated by the fraternity. So without further ado, let's get started with our second podcast.
Welcome to the second episode of TARKA SAMVADA, hosted exclusively by Panchajanya. We have with us Dr. Chetan Upadhyaya, a renowned Ayurvedic surgeon. He is the founder of Praana Vaidya, India's first integrated medical hospital, which has 6 branches in Bangalore and is still expanding. Welcome, sir.
Thank you.
Firstly, we will start with knowing your background and your view of Ayurveda.
Okay, so this question is really vast. If you ask me my view on Ayurveda, I would say whatever I am doing now or anything revolves around my life, majority is Ayurveda. So since from college, it's that I've been studying Ayurveda. It's not just studying Ayurveda. So I have developed a lifestyle which is according to Ayurveda, and I would say somewhere I am living my life according to Ayurveda. Yes.
That's very nice. We would like to know what inspired you to become an Ayurvedic practitioner.
Okay, so let me be very frank. So I didn't join Ayurveda by choice. So it is that I had a MBBS seat, but I was not allowed to go outside Udupi. I am born and brought up in Udupi. So the only option was I had to study something in Udupi only. But I was pathetic in maths, so I had no choice of entering into engineering. I would have flunked all the subjects in engineering. So I thought only in the medicine is the choice. So then in Udupi there was one college, Kasturba Medical College, where I could get through, but the fees was expensive. So the only option remaining was the Ayurveda college that is there in Udupi, and the STM. So with no clue on Ayurveda, I just entered the course of Ayurveda. First year, yes, as in every Ayurvedic student feels, you study physics, chemistry and biology, you jump into Padartha Vijnana, Ashtanga, you're not able to pronounce the subject, forget studying those subjects. I was really scared, but 6 months down the line, yes, I would say these subjects started creating interest. I was inclining towards the subject and the concepts were very fascinating. I thought I should take a deep dive into it and then study. Then second year, yes, Charaka was something which changed my perspective, and after that I studied Charaka first, then studied Ashtanga because Charaka was something which is very close to me. Even now I go back and read that text very often. That fascinates me in a lot of ways. So that's how interest in Ayurveda kept growing and growing. By the time I entered internship, I had almost studied very decent Ayurveda, I should say. I always say I'm a hardcore follower of Samhitas. So I studied a lot of Samhitas. I don't believe in translated books and all. Yes, at times it is good, but what I feel is reading Samhitas gives you a room for your creativity, and you can explore Ayurveda in terms of the boundaries of Ayurveda. That's how you understand the subject very decently. So going on that, the Ayurvedic knowledge also improved and interest also improved. Then I came into the surgery, and then I started exploring allopathy. Then it is the other side of the world what I explored. In a couple of years I have studied allopathy as well as surgery as well as Ayurveda. That's how I came into integrated medicine.
Wow, it was such an interesting journey, sir.
Yes.
Basically, Ayurveda is built upon some fundamental principles which is applied in almost every aspect of Ayurveda.
Yes.
Could you explain some of these principles and how these principles are different from other healthcare systems?
Okay, so Ayurveda is basically rooted with lot of fundamental principles. For me to pick one principle would be a tough job, but I would, if you ask me, yes, this is a very nice principle what Ayurveda says. Charaka says, Pratyaksham hi alpam, analpam hi apratyaksam. That means what you see or what is perceived through your senses is just a small fraction of what exists in the world. So we in Ayurveda are believers that whatever we can't see or we can't sense, much more than that exists in the world. But on the contrary side, the Western medicine is just, they say Pratyaksha is only Pramana. Okay, if you say in Sanskrit, whatever you can feel through your senses is the only truth what they believe. But Ayurveda is something much more than that. We believe in Yukti Pramana, we believe in Punarjanma, a lot of things. So in the Ayurvedic way, if you ask me what is allopathy, I would say it is a sort of Charvaka Darshana, because they believe only in Pratyaksha, and Ayurveda is much more than that. If you ask me another principle what is very fascinating to me in Ayurveda is Loka Purusha Samvada. Okay, 5,000 years ago, when the whole world was figuring out what to wear and what to eat, we were so sophisticated that we understood whatever exists outside the world, the same thing exists inside the world. Whatever happens outside has a reciprocal reaction inside your body. Now it is winter season, your body has a lot of changes which combats with the winter season. And if it's summer, the opposite thing happens. In the day also you have the rhythm. In the morning there is one dosha which is more, so your lifestyle is different, your mood is different, and after 5,000 years, after so much of research and spending, now the Western medicine have understood there is something called circadian rhythm, and they tell it in a fascinating way, but basically it is just nothing but the things which are told in Ayurveda. So Loka Purusha Samvada is one of the concepts I would really think it always fascinates me.
Thank you, sir. Now that we have understood the basics, let us move on to some clinical aspects. Sir, when you work with a patient, how do you diagnose the patient and what methods and tests do you use?
Okay, so my practice has been an integrated practice. I am not a type of Ayurvedic doctor who just is anti-allopathy or anti-Western medicine. I see everything. There is always a scope for coexisting and healthy understanding, and that's how the growth of the medical science happen. End of the day, you need your patient to be better and things happening in a good way. That's where you get results also. So my clinical practice has been, I would say I have developed my own way of clinical practice, which is influenced by a lot of my lecturers, my gurus, and people who have learned from. So if I get a patient for that instance, I first believe in Trivida Parikshas, Darshana, Sparshana, Prashna. First I say history taking is the key. So if you are a master in history taking, your diagnosis is done the time you are finished with your case taking, because a patient always knows why he has got the disease, and he is here, he will tell you why he has got the disease. So it is just the smartness and the skill of the doctor that you have to dig out what you want from the patient. So you ask decent questions and you get the right answers. Half of your diagnosis is done there. After you finish your diagnosis, there comes the examination. So you have Dashavida Pariksha. I am not going to the textual things. So you do a lot of examination, relevant examination to the history and the case. You take it. After the examination, you come to a diagnosis. Once you are arriving to a diagnosis, to confirm your diagnosis, you get into investigations. But unfortunately, you see in the present world, the investigations are done first, and based on investigation reports, you come to a diagnosis. If that is the case scenario, even patients after the investigation, they don't need a doctor. They can see the report and they understand what the disease is. But I strongly believe it's about the skill of the doctor. It's the questioning and the history taking and the examination with which you come to the Vyadhi. That's when you diagnose a disease. Okay, that's my way and that's my approach of understanding a patient and a disease.
Yes, sir. It's a very holistic way of approaching.
Yes.
There are so many ailments that mankind suffers from. And there will be certain ailments that show significant results using Ayurvedic treatments. Can you give some such examples and the treatments that you have used?
I will change your question little. If you're asking me, there are some diseases which Ayurveda gives better answer. I would say every disease is answered by Ayurveda. Not that all diseases are only answered by Ayurveda. There are some diseases which are answered very well by Western medicine. There are some diseases which are very well answered by Ayurveda. So it's just that what time what medicine has to be given is the key and the answer. Okay. Now if Ayurveda as a speciality has its upper hand in the present era, I would say skin diseases and the autoimmune diseases are best answered by Ayurveda as per my experience. Now I have been practicing past like 4 years, proper practice of 4.5 years. I have treated autoimmune diseases which are rejected by almost all the hospitals. I recently had a patient, she had almost 12 diseases and she was on steroids, like steroids she was on, immunosuppressant she was on rituximab, the last resort of all the things. If she was continuing the same medicine, probably under 5-10 years she would have been dead. She was just 32 years. And we with our Ayurvedic techniques, it's again, they integrated. I didn't stop her steroids. I asked my rheumatologist to get it consulted. He tapered the steroids. I started my Ayurvedic medicine. Within 4 months, she was off steroids. She was only on Ayurvedic medicine and she has no symptoms now. So that's how I say integrated medicine with Ayurveda in the upper hand or sometimes Western medicine in the upper hand will cause a difference, and that's how the answer is. And skin diseases, though, Praana Vaidya is known for skin disease. We get patients from Bijapur, we get patients from other states also. Skin diseases which have been treated by Ayurvedic doctors or allopathy. Allopathy has no much things to do for skin. They have a couple of limited. For acute skin diseases, yes, they do well. But for chronic, they refer to Ayurveda. So we have very wonderful line of treatment. We follow the proper textual methodology. I am not a very fan of patent medicine though. I write a lot of classical medicines and our medicine list is also very limited. I just follow 20 medicines and everything and anything is sorted out. So with that, skin diseases or the autoimmune diseases and all the chronic diseases, yes, Ayurveda, I should say for the present world, this Ayurveda should be the answer.
Especially with the rise in chronic diseases.
Yes, lifestyle, yeah.
So the next question is, when there is a patient, how do you decide which medicine or which treatment is right for that patient?
You are asking me the allopathy Ayurveda or in Ayurveda, how is it?
In both.
Okay. See, this is how Charaka has explained the yukti. Now, if you look at the qualities of a Vaidya, he says first one is the yukti or the smartness. Now, what is smartness for a doctor? So, you get a patient, you diagnose is the easy thing. You diagnose a disease. Then you end up in a question, what medicine to give. Now, if you read the Ayurvedic textbooks, for Jwara there are almost 1,000 medicines. Now you have one patient with fever, you have 10 medicines in the pharmacy, what treatment do you give, what medicine do you follow? That's when the smartness of a doctor comes. Okay. So you have a set of medicines. This is how my practice is established. I have a very set of medicines for this disease. Yes, I have seen result in these and these. You can't keep only one medicine because every patient based on the dosha and based on the prakriti, you have to keep little tweaking them and there, wherever we were. There are set of medicines with which I say yes, now patient has come with Damavata, after Virachana, I have only 3 or 4 medicines which are fixed based on the dosha which is in the peak. I select one medicine, that's how I give. If you ask me on a broader spectrum, if a patient has come, let's take the same Amavata. If a patient has come with acute severe pain, which is starting from 3 months and he has already got a lot of clawing, he is not able to wake up from the bed, that's when I would definitely call for a rheumatologist, ask him for a consultation, get him on steroids for we have something called a short intermediate steroid therapy. You give a high dose of steroid for a couple of days and taper it in the right way. That doesn't cause you a lot of complications though. If steroids are taken in the right time, steroids are sometimes life-saving. If you are in a deathbed with an asthma, you can't expect that I am an anti-steroid person, I am an Ayurveda. That doesn't work though. So a rheumatologist does that job. Once the pain is settled and patient is comfortable, that's when I ask the rheumatologist, from now on I will take over. That's when the Ayurveda comes in and we do the root cause analysis and we treat the disease from the core. So overall who is in benefit now? The patient is benefit because acute pain is also resolved and the final solution also given. So that's how our clinical practice has been. We don't go behind the system of medicine. I would say we are patient centric more than the system centric. That's how our treatment methodology is.
Thank you so much.
Yes.
It shows so many students are really aspiring to be successful doctors like you. Could you give some suggestions and some advice to students who wish to build a successful practice?
Okay, to all the Ayurvedic students who are watching this, please study Ayurveda. Because I do understand that unfortunately BAMS has been a lateral entry for anybody to be a doctor. Now 99% of everyone who wanted to be a doctor somehow for some reason not got MBBS or didn't get into MBBS, but you need the tag of doctor, so it's like a wild card entry. You do BAMS, all your 5.5 years you're into Praana Vaidya, you have not got your seat, so somehow you have to become a doctor. So every time in first year you're not interested in Ashtavarga, you're interested in dietary physiology, you're not interested in Sushruta, you're interested in Grey's Anatomy. So all 5.5 years you're doing half Ayurveda because you're ready for exams and half allopathy because that's where your interest is. So end of your course, you come out, then you realize you have not studied Ayurveda, not studied allopathy. So that's when all the students are stuck, and that's where the whole fraternity is not able to figure out what next after the course. So if you take my suggestion, this 5.5 years you have come with your choice or not with your choice, the only option you are left with is study decent Ayurveda, because the way the world is approaching now, if you are now you see there are every Ayurvedic doctor the next door. If you have to be a competent Ayurvedic doctor, why should patient come to you? You should have that command over the subject. That's when you can be a successful doctor. So if you can't study Ayurveda, you're trying to do everything half this, half that, definitely you can't be successful. So if you have to be successful, and study genuine Ayurveda. So for studying genuine Ayurveda, if you ask me a tip, I would say first year is the most crucial. People think final year is the crucial. I would always say first year is the crucial, because in my years of practice, I don't believe in lot of fascinating diagnosis or fascinating medicines. So I always, if I see a patient, I don't even sometimes name the disease. For me, it is just that Vata, Pitta or Kapha, either of the three, which is the problem, you settle that problem, your answer is given. So if you have studied decently in your first year, you can even skip the final year, some subjects, you will be a successful doctor. So it's all that the fundamentals have to be strong. If your fundamentals are strong, nobody can stop you from being a successful Ayurvedic doctor. Yes.
Yeah, as we all know, BMS is very vast.
Yes.
And we have to study extensively all throughout the 4.5 years. Could you suggest some certain skills or certain areas of knowledge that the student has to really specifically focus on?
Yeah, so BMS is a vast subject is what I feel. I wouldn't agree that MBBS is also damn vast. So all this, but Ayurveda, the problem is you will have to study a lot of things from different subjects. Okay, one way it is a problem, one way it is a good thing, because you come out, for me, take my example, now I come out, I am operating a case, I know this is what in the Western medicine, I know the anatomy, meanwhile I know the proper things what is told in Ayurveda also. So it's a advantage for me which I have on the other hand which Western people don't have. So that's one thing. So in your college life, if you have to study something which is a key, I would say in Ayurveda just first focus on samhitas. In terms of Western medicine or allopathy, you correlate the samhita with the Western medicine. That's a very nice way of doing. If you're doing the vice versa, if you're correlating allopathy with Ayurveda, you are on a wrong track. So what you have in Ayurveda, it's always better that you correlate it to Western medicine. So it's not just for your knowledge, because these are the unexplored things. So if you find out something which is very interesting, which is told in Ayurveda, which is told in Western medicine, you can even publish an article. You'll become famous that way also. And it's an easy way of learning the subject, no? So always study Ayurveda first and correlate this with the Western medicine. Now everybody is curious, why are we studying allopathy also if you are in Ayurveda? But nobody knows the real reason. So modern anatomy is given so that you understand the Ayurvedic anatomy in English terms. It is not that you understand English anatomy and a little add-on Ayurvedic Sushruta there. Okay, so people have mistaken, I mean students have mistaken. So the right way of doing it, you have to study the proper Ayurveda, then correlate this with the Western medicine or the textbook body in the Western medicine. That's where your problems are solved and your question is answered.
Yes, thank you.
Yes.
Could you suggest some books or some resources so that the student who wants to learn Ayurveda more in depth, apart from textbooks and reference books?
Okay, so first it's all the samhitas. Yes, so 5.5 years are not enough to finish your samhitas though. If in case somebody is so smart and finishes our samhitas, I mean at least once, and you get a proper understanding of the samhitas, then there are other books, no, clinical oriented books. I would suggest Vaishya Ratnavali is one of the best books. See, because Vaishya Ratnavali you can't read before you know proper nidana or the disease. if in case, worst case scenario, you have not studied the disease properly, you have not studied the exact, let's take Rakta Pitta, you have not understood Rakta Pitta in depth, and you directly gone and read Vaishyaratnavali. You know, Vaishyaratnavali is a to the point book. It is written Rakta Pitta Adhikara, there are hundreds of medicines given. So you see a patient, you don't diagnose it properly, and what point in reading the medicine? So you have to read the Samhitas first. After Samhitas, you can refer textbooks like Vaishyaratnavali specifically for the advanced medicines, or if you want to explore all the different types. See, I would say I believe in a lot of Ekamudika Prayoga. I don't write a lot of different medicines. For me, it is like after every I give either only Triphala or only Guduchi in a higher dosage for 1 month, 2 months. I don't believe in a lot of medicine, but every Ayurvedic doctor has a different way of practicing. No? So if you want to explore the medicine options, you can read Vaishyaratnavali. If you want to see other type of South Indian Ayurvedic classics, you can go for Sahasra Yoga. There are hundreds of books for that. And there are some books in the present era, I don't even remember the names properly because I'm not a great fan of such books. I think L.N. Mahadevan sir has written one book. That book is a good book to read. So, but not at the cost of sacrificing your Samhitas. First finish off the Samhitas, finish your basic core. Once your core is strong, then yes, you are open to read all these textbooks.
Finally, let's move on to what Praana Vaidya is also all about. That is integrating Ayurvedic medicine as well as modern healthcare system. What is your point of view on this?
I would say this is my brainchild. This is my dream. So I will tell you why I started this. So I finished my Ayurveda when I came to Australia. I finished my surgery. I was working as a surgeon. I was working as a freelancing surgeon. Probably in 2 years I would have done more than 2,500 surgeries. So I've been traveling and operating like crazy all around Bangalore. So I was operating in allopathy hospital. So every other patient I see is, if you go to a surgeon, you definitely understood you'll get operated. If you go to ISKCON, you can't expect chicken. You have to expect pongal only. So if you are going to a surgery, he will definitely say you should get it operated. So I was into that bondage. So I used to see patients, I was telling surgery is the option. But every patient has the only one answer: without surgery, can you do anything? But I am sitting in an allopathy hospital and I say all the surgical cases I am doing through Ayurveda will throw me out. So I understood there is a problem and there is a lacuna, but no one is answering this. We were forced to operate on patients knowingly that without surgery at some point, at some disease I can solve. On the other hand, I have seen a couple of Ayurvedic hospitals, you know, it is a proper surgical case. You can't do anything with Ayurveda at this point of time. You need to get it operated, but they give a try. They say let's try it with Ayurveda. They do it for 3 months, get the disease worsen. At the end stage, you refer them to allopathy hospital. Then you take the blame for the home fraternity that Ayurvedic doctors are delaying the treatment. So I see there is a lot of, and basically all the hospitals are system centric. Now if you go to an allopathy hospital, they don't give you what you need. They give what they have. If you go to an Ayurvedic hospital, also it's the same. They are there to give their panchakarma or their treatment. They are not into the what patient needs. So that's when I thought we can do something to bridge this gap. That's when I came into an ideology which came up with the name of Praana Vaidya. Here what we do is, if a patient comes, as I explained earlier, so based on the situation of the disease, we give the patient option. But this is the line of treatment, what I feel is better. We give an Ayurvedic consultation, we give an allopathy consultation. Then both the doctors sit together. When I started this company, everybody told this is not going to work because you can't bring an Ayurvedic doctor and an English doctor together. I told us, people who are okay with this mentality are with us, not okay with this, not happy. But we are lucky. I have big neurosurgeons, I have cardiac surgeons, I have Ayurvedic pediatricians, but everybody in our company are with this mentality that patient is first. So after they finish their consultation, they both sit together, they unanimously decide and tell, I think this is when Ayurveda should work, you do your treatment, after your season you refer to me. Or sometimes the allopathy doctor finishes, then he gives to the Ayurveda. So we have that synergy. And after the patient gets the benefit. If he goes to any other hospital, he doesn't have this option. No? He does one system for 6 months, then fails, then go to the other place. They're trying to combat that time and give everything possible present in the world at one place. That's how Praana Vaidya has been establishing. We are not a very old company. Just 1.5 years old, but yes, God has been kind. We are expanding faster. We have 6 branches, and another 3-4 are pipeline. I think by this year, we'll be ready with 10 branches.
Oh,
yes,
very nice. So, what are the key benefits that a patient will benefit from if he gets such an integrated therapy?
I would say first thing is he will not be misguided. Okay. He wouldn't be misguided on what the doctor knows. He would be told what the patient exactly needs, And second thing is, you can actually prevent the patient from getting that trouble of getting disease worsen and then getting the right system of medicine at the end. You're bypassing everything. You're giving the right day at the right time so that the right things happen. Yes.
That's actually very, very nice, because
Yes.
lots of people these days suffer because they're not getting the right treatment at the right time.
Correct.
Here we get everything at the same
Yes.
at one place.
Correct.
Basically, any medicine is very, very potent, and it will show reactions in the body, good or bad. And it's same in both Ayurvedic as well as allopathic
Yes.
medicines. When we combine these two, how do you ensure the safety of the patient when combining these two?
Very good question. I had this question being asked since inception of this company. So I would say, see, now in Praana Vaidya, what happens, or for any medical integrated company, what happens is, if an allopathic medicine is given, it is given by an allopathic doctor. There is no compromise. If an Ayurvedic medicine is given, it is given by an Ayurvedic doctor. So we ensure that there is equal gap between the two medicines are taken, and both the doctors willingly understand that these don't have any interactions in between, and that's how we try to prescribe the medicine. If you ask me for a scientific evidence, yes, we are in a very starting state. We are expecting a lot of things. People like us should come up in the field of integrated medicine. In another 10 years, I started this company with the vision of integrated medical revolution. 10 years down the line, every hospital is an integrated hospital. My job is done. So that probably after 10 years, when that ecosystem comes, we can give a lot of scientific evidence. But for now, what we are doing is, every system of medicine, the same doctor is following, and we give a decent gap between the two medicines so that we can avoid the maximum drug interactions. And we, as much as possible, try to avoid mixing. Once you finish a one line of treatment, then we take into the other system. That's how we do. At times we'll have to mix. That's when we give a lot of gap, and we make sure that the doctors have different discussion and try to see if there are any evidences of any reactions and all. We've been trying to do. Yes.
Patients, if the patient is not very, very accepting of any new system of medicine, how do you convince, or what do you say to a patient who is skeptical about this kind of an integrated therapy?
Even I had this doubt when I started Praana Vaidya. People were telling me, patients have a lot of misconception about the healthcare. No, somewhere it has been exploited by the healthcare fraternity also. It would have been a challenge. Probably people are telling me it will be a big challenge for you to convince people. But I see the present generation, one way being educated is an advantage, because people are educated, they understand the benefits of this. We explain them. If you go out, these are the options you get. If you come to us, we give all the options to you at one place. And if you're smart, you choose the right one. If some people are that we are to be traditional, we don't choose it, then you can't force anyone. But I feel the crowd in the present day is smart enough. They are choosing the right one. That's how probably our company as well as integrated medicine is growing. And government is also too much supportive. Already government of Modi has started the integrated medical institutions in North India. Many more are yet to come. Yes.
Very, very nice. We have come to the last section of TARKA SAMVADA, that is Satya mitya. Here we debunk all the myths related to Ayurveda and present the truth of the ancient healing science before you. I will say a few statements, sir, and let us just debunk whether they are myths or whether they are truth. The first statement is, Ayurvedic medications should never be taken alongside allopathic treatments due to potential harmful interactions.
If the statement is given by an Ayurvedic doctor and allopathic doctor, I would agree, because they would know the medicine. If a layman walking on the street says this, I wouldn't agree. So if both the medicines are taken in a right gap interval and prescribed by the right doctors, it wouldn't cause a problem. But a layman commenting is never right.
The second statement is, Ayurvedic medications are slow acting compared to modern medications.
I think one of the Ayurveda doctors would agree this. If any allopathic doctor is telling this, that means, of course he would tell, because he wouldn't have studied Ayurveda. Now, any Ayurvedic doctor commenting on allopathic medicine is wrong. As equal as an allopathic doctor commenting on Ayurvedic medicine. There are potential medicines in Ayurveda which are much more faster than allopathic medicine. For that instance, if you ask me for fever, if how efficacy Delo has, in fact, little more efficient. There are medicines like Lakshmi Narayana Rasa, there are medicines like Nabhivati, which are very rarely practiced, but few Ayurvedic doctors still know those. You can have antipyretic action within 15 minutes. Even they will take 20 minutes. So there are better Ayurvedic. But I would say if anybody says Ayurvedic medicines are slow, I would say Ayurvedic doctors are slow. Not the medicines. If you get fast Ayurvedic doctor, your treatment and the medicine also fast.
The third statement is, Ayurvedic medications do not have any side effects.
I will give you some instances. There is a medicine called Eshtimadu. So Eshtimadu Rasayana, there are a couple of patients who had consumed Eshtimadu Rasayana for 1.5 months and they found very good results. When they thought what consult with the doctor, they continued the same medicine. After 2.5 months, they had severe hypokalemia, they were dead. So it reduces your potassium levels to an extent that it causes bradycardia, patients were dead. And some people have consumed Amrita Arista or Guruchi Rasayana for quite a long time. They have ended up in very bad liver, kidney injuries and ended up in dialysis. Now we understand Ayurvedic medicines do have. End of the day, these are also medicines. If they are not medicines, they are like food, how would they act? So if they are acting and giving you some results, anything taken in excess is very bad. So Charaka says, the same thing he said. So anything taken in the right quantity is right. If you take it excess, anything can become poison. Definitely it does have side effects. That is the reason I say Ayurveda, and there is a big misconception, anything green and anything prepared at home out of your kitchen is Ayurvedic. I say, if that is so, why do you have to study 8 years and struggle so much and then finish your exams and set up something like it and sit as an Ayurvedic doctor? Definitely it is not. And if somebody in some village is giving some herb or a root and he claims himself to be Ayurvedic, that is wrong. That is folklore. There is a lot of difference between folklore and Ayurvedic. Ayurvedic are me and you or somebody who is studied and put our youth at stake and sacrifice this age and come up here as doctor. So somebody sitting outside gives some green grass and says Ayurvedic, that's not right. Okay. So a right thing given from a right doctor is correct. So if you are doing it by yourself, you are some internet doctor, then definitely it would have side effects. That's how Ayurveda also can be fatal at times.
True. The last statement is Ayurveda works only for people with specific body types.
Okay, so Ayurveda is not caste oriented or religion oriented. So Ayurveda says the whole world is of different body types. I accept this. And Ayurveda has not told Ayurveda is only for one body type, either for Vata or Pitta or Kapha. You identify what body type that person is, give a treatment. If you had any problems after taking Ayurvedic medicine and the reason was mismatch of your body type, that means your Ayurvedic doctor is at fault, not the system. Your doctor is not able to find out what Prakriti you are of and not given you right medicine. If you approach and right Ayurvedic doctor, he does your Prakriti assessment properly and then does the Vikriti assessment and gives a right treatment. Definitely every body type has an answer in Ayurveda.
Yes, sir. Thank you so much, sir.
Yes.
Your talk was very insightful and we really understood how you approach integrated medicine, and there are so many students who are aspiring to be successful like you. Thank you so much for having us.
Yes, well, I would love to see a lot of Ayurvedic doctors come out and start something of their own and at least contribute something to the fraternity, because you see there are every other person in the allopathy fraternity trying to contribute to their science. Now if we as Ayurvedic students or doctors, if we don't take a lead, whom do you expect? Now the other side is happening is the Western guys are interested in Ayurveda, foreigners are studying it and getting patent. So before they take patent of Ayurveda, let's take patent of Ayurveda by ourselves. That is what I want to end with.
Yes. Thank you so much.
Thank you.
What are some internship opportunities for a student who has completed BMS?
Okay, so I would say first opportunity Praana Vaidya is open. So we are planning to train a lot of internists, especially Ayurvedic internists. It's more of sharing our knowledge in clinical practice and making people understand that something like integrative medicine also can work. So that I am trying to put some seeds in the hearts of Ayurvedic students so that they also can come up with ideas like this and contribute something to society. If other than Praana Vaidya, there is a program run by central government called RAV, if you've heard of it. Okay, so that in that program, the government recognizes a couple of very old and more than 10 years of practice Ayurvedic doctors who are very efficient and strong in their practice. They are assigned to students. After BMS, you can join there as an intern also and can learn good things. Otherwise, you can join some big Ayurvedic hospitals where you can learn. So, Praana Vaidya is definitely, yes, we will be loving to train people who are interested to learn Ayurveda as well as integrated medicine.
That is very nice. You have already established a very successful practice, Praana Vaidya. Apart from this, we have heard you also play Veena and you're very talented in Shloka Parayanas and everything. Could you tell us more about that?
I always come across this question wherever I go. I am in fact not just a Veena player, I am a performing artist. So I perform and state level play now. So people ask me how do you manage everything. So I say it's not about managing. So you have 24 hours. So how many hours do you think we can work? You would work around 6 hours. maximum you stay in yourself, you can work for another 12 8 hours, and you sleep for 6 hours. You still have other 6 to 8 hours. No? That's more than enough time. Morning around 4:30 after I wake up, and I live a very Ayurvedic lifestyle. That's the reason of I am healthy also. So I wake up at 4:30, 5 6 around I finish gym, and then 1 hour of Veena practice. So Veena is done the next day. Then you read little. I do teach Veena also. Then the whole day I do Praana Vaidya. No? So there is enough room and enough time for everything. For people who complain there is no time, I always ask them to stay with me for 1 day. Then you really realize how much time are you wasting in your life. So if you start using all your time, definitely you can do much more than what I have done. I would say yes, really, there is always space. It's just that you will have to have the intention of doing it. If you have that thought and intention to do, you can do much more.
This basically strengthens the fact that where there is a will, there is a way.
Definitely.
There is one question asked by an Instagram follower. The question is that can an Ayurvedic graduate practice in the army?
Yes. So I think last year onwards they have opened a post for Ayurvedic doctors. Not last year. Yes, this is a couple of years ago, but it was not very famous. But now recently you have postings in army offices. In fact, in Bangalore also, in all the army posts you have doctors, and the BMS doctors you have full-time vacancies. For specialists, you have on-call facilities, as well as they have started hiring specialists also. You have Panchkarma PGs hired, you have Shalya PGs hired. So definitely there is a scope in army also. It is just that you will have to go into their army site and wait when the openings are. When there is opening, if you apply and they have their own exams, if you clear through, yes, there are postings. I recently have met a couple of Panchkarma PGs who are practicing in Jalalli also. They have their own dispensary. They have Ayurvedic medicines also dispensed from the army also. And they have, if you get treated from outside facility, I have treated a couple of army patients here, they can reimburse the fees also. That is also covered. So Ayurvedic doctors also are hired, and Ayurveda is promoted by army also.
Very,
Yes.
very nice. Thank you so much for giving us very insightful talks into your vast experience. This is a small token of appreciation from Team Panchajanya.
Thank you. It's my pleasure.